Well, he's known as the longest-running headliner on the Las Vegas Strip.
Now, female impersonator and comedian Frank Marino is ready for a change and shared his story with Action News reporter Megan Tellis. Megan.
Yes, Steve and Tricia, we're used to seeing Frank Marino on our midday show to recap all things Dancing with the Stars, but he had a major procedure done this week, and he took me behind the scenes to explain why. Take a look.
It's not easy being Frank Marino, a man by day.
Is everybody having a good time so far?
Drag queen by night, declaring Joan Rivers as his diva alter ego 30 years ago. Marino ditched those glittery gowns for a surgical gown this week when he got a facelift. And it's not his first cosmetic surgery.
How many plastic surgeries have you gotten?
I would say I've had 15 plastic surgeries. I know I did my chin 4 times because I wasn't happy with it.
Then there's his nose.
I had my nose done like 3 times.
He also admits perfection is his addiction. His first surgery at the age of 16.
So when I realized I could take care of a problem like that, it becomes addicting, I'm not gonna lie. It's not for everyone. I'm not recommending it to anyone.
Cosmetic surgery, he says, is his way of keeping up with the Joneses, or in his glamorous world, the divas.
I go on stage every night and I have Britney Spears and I have Katy Perry and I have Pink, and we're taking pictures, and these kids, like yourself, are in their 20s. I just turned 50. I don't have to compete with them, but I want to be able to look good for me the way they look good for themselves.
After years of research, Marino selected 2 doctors for what could be his final surgery.
He's a tough patient because he dresses as a woman during the show. He has 2 conflicting desires. One is to look feminine and the other is to maintain his masculinity.
Dr. Anson perfecting his eyelids, lifting his face. Dr. Glyman redefining his angles.
What I have to do is be able to put these implants in, secure them so they don't move, so that it gives him definition to his jawline.
It's like Russian roulette. You don't want to do it, but you live, it's a high when you finally come out of it.
And there he was. Frank survived. That was him you just saw being wheeled out of surgery on Monday. Now, I just got off the phone with him. He's doing really well, really swollen in the jaw and facial area. He said if his brothers and sisters thought he had a big head before, well, there's proof now, right? Frank promises to share before and after photos and video with all of us, so stay tuned, all right? Tricia, Steve, back to you guys.
Megan, thank you. He looked great anyway, but I cannot believe he's 50. Yeah. That's what cosmetic surgery will do for you.
And, you know, he's good for him for, for putting that out there and letting everybody kind of share it, because we all, everybody around here knows who he is.
And he's got 2 great doctors, too, here in the Valley.
Yeah.